When you think of the Middle Ages, what comes to mind? Probably darkness, superstition, plague, and definitely terrible medicine, right? But what if I told you that in the heart of medieval Europe, doctors were performing brain surgery, and many of their patients survived? This is the forgotten story of trepanation, an ancient medical procedure where doctors drilled a hole into the skull. Sounds barbaric, doesn't it? And yet, it worked. The practice dates back thousands of years, but in the Middle Ages, especially between the 12th and 15th centuries, it was more common than you might think. People suffering from head injuries, seizures, or what were believed to be evil spirits were often taken to local physicians, monks, or even barbers, who would carefully remove a section of the skull, not to kill them, but to heal them. And here's the surprising part. Many of them lived. In fact, archaeological findings across France, Germany, and Eastern Europe have revealed skulls with surgical holes, healed over. That means not only did these people survive the procedure, they lived long enough for the bone to begin regenerating. So how did medieval people, without anesthesia, antibiotics, or modern tools, manage to pull this off? First, they understood trauma better than we give them credit for. Soldiers and physicians on medieval battlefields were used to treating blunt force injuries. If someone had a head injury and showed strange behavior, confusion, rage, unconsciousness, they believed pressure inside the skull needed to be released. Second, the tools weren't as crude as you'd imagine. Bronze and iron surgical instruments with sharp, curved blades designed specifically for bone were used with surprising precision. And finally, cleanliness, though not understood in a germ theory sense, was part of many religious medical traditions. Surgeons often used alcohol-based herbal tinctures and heated their tools with fire, reducing infection risk without even knowing why it helped. Of course, not every surgery ended well. Some patients died of infection, blood loss, or shock. But the success rate, considering the time period, was astonishing. And here's where it gets really interesting. In some cultures, trepanation wasn't done for medical reasons at all. In parts of Peru and the Balkans, skulls show signs of multiple trepanations, sometimes on people with no visible injuries. Could this have been ritualistic, or a misunderstood form of mental health treatment? What's clear is this: trepanation was not some random, brutal act. It was a deliberate medical procedure carried out by people who, though they lacked microscopes or diplomas, had a surprisingly functional understanding of human anatomy. And somehow, we forgot that. We imagine the Middle Ages as ignorant and brutal, but scattered throughout the centuries are moments of astonishing knowledge, creativity, and care. So the next time someone calls the medieval period the Dark Ages, remember the doctors who carefully opened a human skull and saved a life. Not so far behind the times, after all.